Hey everybody, it is Susan. I'm just sort of coming to after surgery number 3 for lipedema removal, and this one was a little bit different and a little bit rough for me from a pain perspective, which is funny because in our forums we've been having conversations about how much pain there is and that kind of thing. So let's see, Dr. Schwartz is super busy, and I don't think I went back for surgery until like 7 or 8. I was scheduled for 4. Totally no problem. You all know if you have a phone and a nice place to sit and good people to talk to, that you can do it. You could wait for a while. So I was just super grateful that he was able to get me in. So we worked on this area that was like the side of my butt. I call it my ham hock, and it was really been giving me a lot of pain. And so that was like my number one goal, was to get out of pain. I mean, because it was affecting my mobility. And like last week I went to DC, and by the end of the week I was just really having trouble walking and stuff like that from it. So I circled that one and wrote ham on the side, and then he did the middle of the thighs, and then what's called the butt shelf, which goes right across the back. And surprisingly, he did my upper arms, and they feel great. They're so slim and toned. He even worked around like the deltoid muscle and stuff, so to give it some definition. So interestingly enough, I told him that I have it in my mouth, and he was like, you need to say Dr. Herbst and show that to her while you're here. And of course, I'm like, please don't let it grow. So anyway, surgery went fine. I woke up, and their nurses, of course, are so sweet, and you stay for a while. When you have to leave the OR after like 6 o'clock, like an evening pickup, they don't, if you're staying at a recovery center, they don't come and pick you up just like in a car or whatever. They come and take you in a transport, like a medical transport. So it's, even though it's just like right down the street on Dr. Schwartz's street, they put you on a gurney and then take you in. And then once you get to the hotel, there's like a whole staff of people waiting to check you in and pamper you ridiculously, right? So they picked me up in a wheelchair, brought me upstairs, and then there was 3 nurses like taking vitals, seeing if I needed to change, seeing if I wanted to go to the bathroom, bringing me a snack, bringing me water. I mean, so this place that Dr. Schwartz's office has sort of recommended is a different experience. It's really, really good. It's a Marriott hotel, and so it's not as super fancy, but I would rather have the help that I need than a fancy hotel that I'm basically just gonna sleep in. So also this time you can see, let me see, I'm sorry for like the grossness, but they've got me on just a slow IV drip all night long. They always send you in with a PICC line, just in case you need help or whatever, and it'll probably come out tomorrow when I go into my post-op appointment at noon. But I am experiencing, or had been experiencing, quite a bit of pain. So it's like 3 in the morning, and I'm just now starting to relax. I hate to do it, but I had to take a Percocet because we tried the ibuprofen and acetaminophen, and it just, the pain got out of control, and you don't want to get it out of control. I'm hoping, excuse me, that I can switch to alternating Tylenol and Motrin now for the rest of this day, because I'm just so freaked out about like oxycodone and stuff like that. So anyway, when I got up this last time here, they really want you to buzz if you need to use the restroom and stuff like that. So I've had to buzz a couple of times, and this last time I started walking around the room and doing just the basic stretches and trying to do leg circles and stuff like that to ambulate. The other thing I wanted to tell you, because there's been a lot of questions about that, is that I have no drains this time. Thank God. And I'm draining everywhere. It's a hot mess, but that's fine. I don't like really dealing with the drains, so I'm doing a lot of manual lymphatic drainage when I can. And my arms right now, I wish you could hear it, but if you hold them up and shake them, sometimes you can hear like a river running in there, and then it just squirts out all over the pads that are on the bed. So that's good. Get that stuff out, So that's a question. And then they sent me home in absolute supports, over the heel all the way up basically to, over the waistline. And they put me in a different size, a larger size than last time, and it is much more comfortable. I'm not struggling with like it cutting into my knees and stuff, and I think it's probably the right size. So I think that's all I have to tell you. We talked about the COVID test online, and what Dr. Schwartz is asking for right now is doesn't have to be done in California, but it does have to be done 48 hours before surgery, like a maximum of 48 hours before surgery. So I did mine at the international terminal at the airport, LAX airport. Um, but now that I know that, maybe I can figure out how to do a Walgreens if I have to come back for another surgery. I'll give you another update tomorrow when my mouth isn't so dry about what my surgical plan is after this, because it looks like I may have like one more surgery, and then it's probably, and Dr. Schwartz didn't say this, but for me, I think I probably need to make a little bit of a dietary change as far as carbs and sugar. So I'm going to try it after the new year and see if that makes any change in like the rate of growth and stuff like that. Because this ham hock thing that he cut off started growing pretty rapidly, and I don't want that to happen again. Like, he shaved my ham, I don't want it back. So anyway, I am going to do my best to be really still. I'm going to show you the nurses came in, and they've got bed pads all over everything, and they've propped my feet up with pillows because they knew I wasn't comfortable and having some pain. And they've even put my IV hand up on a little pillow to try and get it to drip properly. So my job is to be still and be a good girl. And tomorrow I have decided I'm probably going to stay another night here because I came in so late and I feel like I probably need the help. And then I'll move to the residence inn. So it's numbers on a spreadsheet, it's money, but Aetna may reimburse for it, I'm hearing, so that's good. And I will try when I get back. But I don't want to make a bad decision and get myself in trouble because I don't have the help. So that's the right thing to do. Anyway, hope this helps somebody with a lot of the questions that people have been having. And if you have any questions while I'm here, I've got 2 post-op appointments. I'm happy to ask the doctor and pass it on to the forums. So thanks for the support and everything, and I probably will talk to you 42 times the rest of this week as I do. So have a good day, and I'll see you later. Bye.